How do we know that our cycles are irregular? So most commonly, a female cycle is around 28 to 30 days. So plus or minus 5 days though. So that is around 25-day cycle or a 35-day cycle is considered completely as normal. So anything beyond this, deviation is considered definitely abnormal, and that constitutes an irregular cycle. So starting at from menarche, when you attain your first period, so at the age of 12 or 13 per se, so from that time onwards, usually for the first 4 to 5 years, our cycles are extremely irregular because the hormonal cycle is not mature enough to have ovulation in each and every cycle. So that is perfectly common. But after the age of 17 or 18 per se, the cycle should eventually become regular, wherein up to 25 days to 35 days is considered as a normal deviation of a regular cycle. So a lot of factors are associated with irregular cycles. What are the causes? So I just wanted to touch base upon a few of the commonly asked questions regarding irregular cycles. So mostly patients ask that, is it, do we have to visit the doctor even if we get one cycle irregular, or when is the best time to visit the doctor in case of irregular cycles? So mostly it is dependent on a lot of lifestyle modifications that are happening in your life. So any major changes, um, suppose you are traveling, any diet changes, you've recently gotten married, or you've shifted jobs, or your night shifts are added to your job. So all of these factors play a very vital and important role in your hormonal cycle, and in turn your menstrual cycles. So when is the best time to visit your doctor? If this question is asked, in my opinion, you can observe for a couple of months. So suppose, let's say that I have gotten my cycles irregular in this cycle. So in this month I have gotten my cycle just after 15 days of last period, or I have gotten a delayed menstrual cycle. So for 45 days I have not gotten my cycle. So both these instances are one-off instances. If they are, then I think that we can wait and watch. But if it is a regular occurrence, so per se, like 6 months back also I have faced a similar problem, but at that time, after 1 month, my cycles automatically became regular. But it's gotten repeatedly evident that, okay, this time also I have gotten an irregular cycle. So more than a couple of cycles, you shouldn't be delaying your visit to a gynecologist, because most commonly these cycle related issues are very, very correctable, and they need extremely minimal interventions. So most commonly a visit to a gynecologist is going to, relieve you of your anxiety, and you can work towards a healthier hormone cycle. So what are the most common causes of irregular cycles? So causes of irregular cycles are mostly divided into two parts. One is a hormonal issue, and one is a structural issue. So of course, in a married or sexually active female, the most common cause of a delayed menstrual cycle or irregular spotting can be pregnancy. So first and foremost, we have to rule out pregnancy. If there is no issue related to pregnancy, or if pregnancy is ruled out, then majorly the causes of irregular cycles can be divided into structural and hormonal causes. So hormonal causes may, सबसे पहले there is a thyroid dysfunction. The most common test that we ask the patient to do, if in case somebody is complaining of an irregular cycle, is a thyroid test. So it is the most correctable cause of irregular cycles. Also, if your thyroid comes out to be normal, then prolactin hormone, your LH, FSH. So these four hormones are majorly responsible for your circadian rhythm also, for your hormonal cycle also, and for your regular periods also. So any deviation from normal in all of these four hormones is certainly going to disturb you, regarding your periods. So most importantly, if your periods are delayed by a couple of months, or you're having this problem persistently, then it is always good to check these four hormones. So coming to the next group of problems which can cause irregular cycles is a structural problem. Structural problem means if there is an endometrial polyp, if there is a cervical polyp, if there is fibroid, if there is adenomyosis. So all of these structural problems can be diagnosed by a simple pelvic ultrasound, and they are definitely curable causes, and you definitely do need to visit your gynecologist for your diagnosis. So if in case you have any structural problems, they are always associated with mid-menstrual spotting, intermenstrual spotting, post-coital spotting, that is spotting after sexual intercourse, or extremely heavy menstrual bleeding along with passage of clots. So if in case your cycles are having all of these problems, then definitely it can be a sign of structural problem. So coming to the fourth most important questions, can thyroid related problems can cause irregular cycles? So like I said, thyroid is the most commonly used test to identify if the cycles are irregular due to thyroid or any hormonal health. So basically thyroid related problems can start in a female with just irregular cycles, or many patients complain of increasing weight gain, increase in hypersomnia, what we call it, as increased sleepiness during daytime, weakness, hair loss, or multiple other problems, but mostly in a female. If your thyroid is out of whack, it will generally present with irregular cycles most commonly. So most importantly, otherwise also people ask that, doctor, is there any way to correct these irregular cycles by some lifestyle hormonal health can definitely be improved with the help of a few lifestyle modifications and diet modifications. You can also take help of a dietitian if you need to lose weight, or if your gynecologist has asked you to reduce some weight or increase strength training. So basically muscle mass, if it increases, that also helps in increasing your hormonal balance. In turn, it will help you to regularize your cycles without any medications. So it is very important for us to note one point, that correct diagnosis is extremely important in cases of irregular cycles. Most of the causes of irregular cycles can be, modified with a few tweaks here and there in your lifestyle, diet, or some amount of antioxidant medications for, to nudge your hormones in the right direction. But apart from that, irregular cycles are extremely easy to manage. So please take a consultation from your nearest gynecologist as soon as possible, and feel free to ask any of the questions in the comment section down below. I'll be, happy to answer them. Thank you.